Hey guys, it's Tori Villarreal. Welcome back to my podcast, Tips with Tori. And today's topic of interest is going to be transformational leadership in the healthcare profession. And I have a special guest with me, Chelsea Putnam, BSN RN.
Hello, I'm Chelsea. I just graduated in May with my nursing degree. So I just started my job in the ER. I finished my preceptorship and now I'm on my own. And it's pretty crazy. I've seen a lot of stuff. And there's definitely a lot of leadership concepts that intertwine with nursing, and we're constantly having to use those concepts in my profession.
That's really great. That's really awesome. And I know one of the key leadership approaches in nursing is transformational leadership. And I have a definition here from Leadership Northhouse. In contrast to transactional leadership, transformational leadership is the process whereby a person engages with others and creates a connection that raises the level of motivation and morality in both the leader and the follower. This type of leader is attentive to the needs and motives of followers. And I think this concept is really necessary and beneficial in the nursing field. I was coming across an article that I read of Charlotte McDaniel. She is a PhD RN. And she wrote an article on transformational nursing and nursing service. And she has this really powerful quote about the nurse executive creates the vision and the culture for nurse services, as well as by the nursing staff members who assess, plan, and deliver patient care.
Oh, for sure. I mean, leadership is definitely, I've seen it since I began nursing school. I actually had a whole class named leadership in nursing school. It taught us specifically about transformational leadership and how it works from the executive level all the way down to even CNAs, which are just underneath nurses. They help with basic tasks and things like that. But basically, when you're a nurse, there's a lot of delegating that goes on, and delegating means making sure that the tasks that you give others to complete are within their scope of practice and within their competencies. So there's definitely a lot of leadership. And then also with my nursing managers and my nursing directors, they definitely keep us inspired and motivate us. They keep us up to date with all of our education. There's certain modules that we have to complete within a certain time. So there's a lot of leadership going on there.
And I'm sure communication is definitely key, especially in a high-intense environment, especially as an ER nurse. A journal I read by Ruth M., another RN, who has her PhD in education, wrote a really great article about nursing leadership and management, concepts and practice. And a quote was, communicating with staff members, dealing with conflict, and working with groups is key in teamwork and motivation for others. And so I'm sure in a high intense environment, you have to be ready on your feet, ready to communicate effectively if a patient is internally bleeding or on the verge of death. And so that's something you encounter daily.
Oh, yeah. Communicating with patients and your coworkers is absolutely crucial, especially in the ER, because there's a lot of tasks that you have to complete that, like I said, you need to delegate, or communicating with a patient, I would say, is definitely the most important. Especially when they're critical, and communicating with the family members effectively, because when you're in the hospital, nobody wants to be there. So there's a lot of patients that come in who are extremely agitated. Some of them are combative. So learning how to kind of hide your own stress levels when you have a lot going on in other patients' rooms, and then also communicating with that person without kind of letting down your barrier, and maintaining professional communication, not losing your cool, basically. That's something that I've definitely learned is it's hard to do. And then communicating with your coworkers, there's definitely times where there's kind of a break in communication where there shouldn't be. So let's say I delegate a task, or I say, hey, can you do this or that while I do this? And then it doesn't get done. That potentially could put a patient's life at risk, or, put my license at risk or others' licenses. So it's very, very important to use therapeutic communication in nursing. No doubt.
Definitely. And I liked how you brought up about how when you're speaking to the family of patients, you also have to be charismatic. And that is a huge factor. It's what I like to like refer to from my book, Idolized Influence Charisma. And it's one of those key factors in knowing that a leader is able to act as a strong role model for those followers when, like in an instance when there's bad news for a family, you have to be able to effectively communicate that while taking into account the emotions of the family and making sure you have a leader to look up towards, and meanwhile being that leader for other people.
Oh yeah, I will say that's probably one of the hardest parts is communicating with the family members, especially when you know that the patient's condition probably isn't going to turn out good. Like no matter what you did, or like there's no really improvement that's possible. So being able to communicate that to a patient and to the family is extremely crucial. So
definitely. And I know another key factor is having something that drives you, that pushes you, like even in like your hardest days when you have to experience death, there's that inspiration and like motivation that like keeps you going. And I know it's key to like make sure like whoever you're working with, like at that shift, that you're helping one another, boosting one another, creating an environment that makes you comfortable, and having someone to lift you up when you like don't want to be there,
Oh, I couldn't agree more. I would say that factor definitely began as early like as my first day in nursing school. I mean, with my professors specifically, they're extremely motivational and inspirational, and they definitely push you, but in a good way. And along with that, going into my nursing career, my coworkers we have a very tight knit group. We definitely lean on each other in times, especially when there's a really high census, meaning we have a lot of patients. So yeah, it's definitely there, it's present, and I'm very glad for it. I'm thankful for it.
And that's really great. I'm glad that you have like a stable like team to work with in such a like high intense environment. Reminds me of an article, Taking Leadership Seriously, by Angela Barron McBride. She has her PhD and she's an RN, and she spoke of how important it is to like reinforce with your team and your coworkers that you are prepared to deliver what leaders are expected in high intense skills. You have to be able to demonstrate integrity and practice like intelligent when communicating, like you spoke about, and show that you're there to be a caregiver and the abilities that are like necessary when being a nurse.
Oh, I do agree with that as well. I will say being a nurse, it's definitely a very, like, you have to have a lot of different skills. There's not just technical skills like, how to start an IV or this or that. But it's a lot of the communication and conceptual knowledge as well. So it's very holistic care.
Definitely. And I know like another key factor is intellectual stimulation and being able to practice those skills that you did during your time at your undergrad. You learned how to do an IV, you learned how to communicate and do like certain skills. And now that you're in a public setting in an ER, you are able to practice those skills on your own without having a teacher there beside you.
Absolutely. Learning all of my nursing skills was definitely the biggest hump in nursing school. We had a lot of sessions where we'd go to the lab at school and we'd have professors walk us through all of that and kind of make us critically think about, okay, well, what if you didn't have this or that, or what if you didn't have a syringe with you? Like, what would you do? And that's really important in the ER because there's a lot of times where you don't have what you need and you have no choice but to make a compromise and critically think in that moment. So I definitely think that nursing is constantly stimulating your learning, not to mention healthcare and new research is coming out every year. So we're required to keep up our education and keep researching and make sure that we're up to date with all evidence-based practice. So it's constant intellectual stimulation, no doubt.
And I love that you brought about the topic about new technology. It's evolving every day. It makes me think about another important factor, individualized consideration, meaning it represents leaders who provide a supportive climate and they act as coaches and advisors while trying to assist their followers in becoming like actualized. So although you're new now, you will be that leader later for the future nurses, like you will be there to help them move forward and adapt like with the technology like they've been given.
Yes, I agree. That definitely started in nursing school as well. My professors, whenever I'd meet with them, which a lot of the time we were required to, which is good, they taught us and groomed us how to study in our specific way. They were very, very individualized with how they treated each person. Like if you needed somebody to talk to that wasn't as pushy, was a little bit more sensitive, they would be that person for you. And they would help you with tips on how to study, what works for you, what doesn't. And then going on from that into my nursing career, when I had my preceptorship and I shadowed a nurse, she asked me before we started, how do you learn? How would you like to do this or that? Do you need me to do you need to do it, or can you watch me first? How do you learn best? So I definitely experienced that all throughout nursing.
And I'm glad you had such a comfortable environment to learn, and you continue to have a great environment. I guess as we're wrapping up our time, I just want to ask you, do you have any tips or words of advice for future nursing students that are eager to go into the field of ER?
If anything, I would say just be easy on yourself. Don't be so hard on yourself. Most nurses are, because we're perfectionists and we care. So we care about our patients, so we want the absolute best for them, but you're not going to know everything. You're not going to be perfect at everything. That's just how it is, and that's the beauty of transformational leadership, is because you transform into a leader over time. So right now I'm a novice nurse, but eventually I will be that highly competent nurse.
Awesome. I love that. Thank you. That's Chelsea Putnam, BSN RN. Thank you for coming and speaking to me today.
Thank you so much. I appreciate it.